Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hello, and welcome back to another episode of Straight Up With Steph. Before I tell you who my guest is today and what we're talking about, I want to actually mention something that I keep seeing pop up on social media. Every time I open Instagram or Facebook, I'm seeing a different post. At least at the time of this recording, this is going crazy. It's different creative ways that people are thinking they're going to solve the hygiene shortage. Today, I've seen posts about California dental assistants being able to do some hygiene duties. And there's also an initiative allowing foreign trained dentists to do hygiene duties without having to pass a test. I understand that we are in somewhat of a crisis right now with hygienists, and I think this is a complex issue. I don't think that there is a quick fix for it. It's not simple at all, but I don't necessarily think that these things are the solution. What I do think could be a solution is allowing hygienists to practice at the top of their license and allowing us to do what we know how to do, which is diagnose periodontal disease for one. So many states still don't legally allow hygienists to do this, which is crazy, or allowing hygienists to branch out from traditional clinical practice to treat underserved areas, like doing mobile dentistry, maybe getting a van, maybe going into nursing homes or treatment facilities, hygienists going into medical offices or hospitals, spreading education. We know so much, and it's like our hands are tied because we're just not legally allowed to do a lot of these things. Which brings me to my guest today. I'm interviewing Janet. She is a hygienist here in Colorado. That's where I'm at. And she has her own mobile hygiene business. She has a mobile van. I've seen it myself. I actually did an ergonomic assessment for her, and she has got like everything we could ever want in this van. It's really nice. And she's able to treat patients, set her own schedule, do all of the assessments and testing that we all wish we had time to do, and really treat her patients the way that she wants to treat them. She is an example of a hygienist practicing at the very top of her license. Like I said, I don't think that there's a quick fix for what's going on right now, but this is a really good example of what can be done. Today, Janet and I talk about her history in dentistry and why she chose to start her own mobile business. We talk about all the different treatments that she offers, which is so much more than what most patients are going to be exposed to at a traditional dental practice because she has allowed herself the time. That's the big factor is we know all of these things that we should be doing or that we know how to do, but we just don't have the time, right? She walks us through what an appointment looks like when someone comes to see her. And she also gives advice for people who might be considering doing this and where they should start. I really hope you enjoy today's conversation with Janet. Hello, Janet. How are you?
Hey, Stephanie, I'm doing great. Besides the blizzard that we're having here in Colorado today, I'm doing fantastic. Thank you for the opportunity.
Yeah, I know I'm looking out the window right now and it is seriously coming down. And for those listening, Janet and I both are in Colorado and our annual conference is today and tomorrow and we're just like is it going to happen or anyway, we'll see. But Janet, I'm so stoked to talk to you today cuz you have your own mobile hygiene van, which I have seen in person and I do want to talk about that in a little bit. But first off, how long have you been a dental hygienist?
So I've been a dental hygienist for 25 years, but I've been in dentistry 45 years. I started as a dental assistant and when I was 16 years old and I was in high school. And it was kind of a calling, I think, because I absolutely fell in love with dentistry and helping people. And I just feel like I have a heart of a servant, and I feel like this is my way to serve the public. And it's just been a great thing. And I don't feel like I'm going to be retiring anytime soon because every year, my passion for our industry and what we do and what we can do to help our patients, it just grows and grows. And I'm learning so much. I go to a lot of meetings and I belong to a lot of associations. And I'm like, I'm just blown away at how much of an impact we can have and as hygienists. And so, yeah, 45 years and still going.
That's amazing. I didn't realize you were a dental assistant before hygiene. I didn't have that experience. I went to hygiene school literally not knowing what I thought I knew, but I didn't, as far as what dental hygiene entails. But yeah, that's cool. Do you feel like you're experience as a dental assistant helped you as a dental hygienist?
Absolutely. I
Yeah.
believe that the dental hygienist's role in bridging the gap between the dentist and their treatment and their health and everything is a critical role. And if a dental hygienist doesn't understand and have that background knowledge of what is a root canal, what is the procedure of a root canal, what is a crown, there's so much to know. And I feel like not only did it help me in school, which I was a single mom when I went to school. I had 4 daughters ranging from age 1.5 to 12 years old.
Holy
And,
cow.
and I was able to graduate first in my class because I was very dedicated and excited about being. And of course it was survival mode too. And so, I mentored a lot of the students. I helped them with a lot of things. And our particular dental hygiene program here in Colorado at Pueblo Community College it had expanded duties as dental hygienists also. So we learned how to do fillings, temporary crowns. And so a lot of the things that a dental therapist would do, we learned. And actually, I was in the military in the reserves as a dental assistant for 8 years. And my title was actually dental therapist. And so I did a lot of things. And that was before I went to dental hygiene school. And so I used an ultrasonic and did some simple extractions and
Oh, wow.
a lot of things, fillings because I was in ETA. So, I've placed amalgams and composites and temporaries. And so, but that was part of our curriculum at Public Community College too. So, it was nitric oxide, anesthesia, and then, placing restorations, making temporaries. So it was called Expanded Duties Dental Hygienist. And so that was part of our curriculum and that's part of my certification. And
Okay.
so, anyway, knowing I already had experience in that. So I helped a lot of the students and I was kind of like the oldest, the mom of the hygiene class. And, I really enjoy being an educator because I think that that's one of the main aspects of our job as dental hygienist is educating our patients and then also being kind of a role model and a leader and educator for the rest of the team.
Yeah, that experience as a an EDA and everything that you learned as far as restorative things, I mean, I'm sure that gave you a really nice foundation for when you went into hygiene school. I remember I
Absolutely.
was, in school, and I think it was our first had to have been the first year, and we were learning tooth surfaces like DO, MOD, and I'm like, "I don't know." And I was in a group with all, previous dental assistants. So, of course, they already understood. I was like,
Hmm.
"What is a DO?" Like, I don't know what that means, I just remember being so hung up on that. And our instructors were like, "Well, even if you were a dental assistant, that doesn't necessarily give you an advantage." And I'm like, "Bullshit." Like, at least right now, they
Well, because
definitely know way more than I do.
there were things so some of the classes were easier for us that had the experience so that we could kind of focus on other things. But also I think, being able to help the other students and be like tutoring with
Yeah.
them and everything, I think it was really kind of fun. But yeah, it's a whole new language, you
Oh,
know.
yeah. I was like, "I'm never gonna get this." And of course you do, and it's fine.
Yeah.
But,
Yeah.
so I know that you're really passionate about I mean, from what you post on social media, I feel like you have a lot of passions within dentistry, but something that I see a lot is your passion about, like, holistic dentistry, and systemic health. So that's my perspective, but what is your favorite thing about being a hygienist?
Well, first of all, my favorite thing is connection with the patients and being an advocate and a support in their health journey. And I really believe that, you mentioned medical dental integration and oral systemic connection. Those are my passions. And so I'm constantly learning how to connect the dots more and more for these patients because, as we know, there is chronic illness is a huge problem in the world. I mean, it's getting worse. And so I got into holistic because actually as a dental assistant, when I was about 20 years old, I had liver failure and nobody knew why. We thought, I didn't drink, I didn't smoke, I was clean, I didn't take drugs or anything. They thought, okay, it's hepatitis or something. And we weren't wearing gloves and things back then. And so a lot of exposure to not only, bloodborne things, but also to toxins, which I didn't really realize because we actually used to hold the amalgam in our hands and mix it with our bare hands. And we would stick our hands in all the solutions. I mean, it was constant hand washing, but we had, blisters and contact dermatitis and all this stuff. And plus we were, uh, developing and fixing our x-rays in a tank of liquid in a small dark room, smelling those fumes. And so I didn't know how much of a toxic exposure I was getting to. And I didn't even really know that mercury was a toxin.
Yeah.
Nobody told me. And so as my career was going on and as I was placing fillings and polishing them and smelling the fumes and everything, that's what I believe happened to my liver. But at that time, nobody knew. And it shut down and I was bedridden for weeks. They didn't know what to do. And because the liver is such a regenerative organ, thankfully, I was young and healthy. And so it, spontaneously, also through prayer and faith in God, I was healed, but I never knew what happened. And so I was always very protective of my liver. But during COVID, the silver lining to that was that I found out that, it was probably mercury toxicity and that I didn't want to be in conventional dentistry anymore. And I kind of had a vision in 2009 and I started I wanted to have a wellness center. I wanted to have a business that was the oral systemic connection where people could go in and learn how to cook properly. And people, we would do all of their oral health stuff, but also the different pieces of helping them with their nutrition and their diet and their exercise and their mental health. And it would be a center called Hope for Health Wellness Center. Well, so in 2009, I registered a company called Hope for Health. And then I was still single at that time and I started dating and I met my husband and then that dream just went out because I was all in love and we were, on our honeymoon kind of thing, honeymoon phase and, empty nesters and all that kind of thing. So that dream kind of went away. Well, during COVID, it was reignited and I did a oral systemic health summit. I learned about AOSH, which is the American Academy of Oral Systemic Health. I learned about a lot of different organizations, the International Academy of Oral and Medical Toxicology, and I learned about biological and holistic. I mean, I was learning so much. I was doing probably 40 hours a week of CEs because I was so going down this rabbit hole and I was thinking, I have to resurrect this dream. And dental offices were closed and I saw a dentist on the mobile, iHeart Mobile Dentistry Facebook page that did a talk on his mobile business in Kentucky. And during COVID, he was still seeing patients because you're going to their home, you're only seeing that family or whatever. And then, you can sterilize your unit and everything. And there's not other people coming in and out and that kind of thing. And I thought, this is crazy with dental offices being shut down and they're not essential, but, liquor stores are open and all this kind of stuff.
Yeah. When I saw that, I was like, are you kidding me?
Yeah. And these people are, the public needs to maintain their oral health during this time because with, inflammatory things happening, they need the support more than ever now, and it was one of those factors that was not really listed, like, oh, you have heart disease, you have diabetes, but they weren't talking about, do you have oral infection? Do you have periodontal disease? Do you have a abscessed tooth or something? So it was a comorbidity that people weren't really talking about at that time. So because people were staying home and they were working from home and also schooling a lot of their kids at home, and my daughters homeschool their children, I was thinking, having a mobile practice where I could go to people's homes and see the whole family on their time and in their schedule with one person, not having to, drag the whole family out. That would be a great thing. So I just jumped on it. I just got a hold of a broker that found a van for me. I started buying my equipment, and I resurrected my Hope for Health business that I had registered because it was, in, you know, it was dead, I guess, or whatever, because I hadn't kept up with it and I hadn't done anything with it. And I just luckily had support of my husband because I had this crazy dream to, take out a home equity line of credit and invest like $175,000 into my van and equipment. And I just went for it, and I really didn't know what I was doing or anything. And it's kind of evolved, but I just
Yeah.
wanted to be able to help people and also to be able to kind of call my own shots as far as what type of technology I use, what type of equipment I buy, what type of services, and mainly how much time I got to spend with my patients. So my patients,
Yeah.
they get about 2 hours with me
Wow.
at least. And sometimes we use it all, sometimes we don't. But that's what I kind of like about this period, this phase or this season in my life, that I can really just focus on really thorough connection and care to the top of what I can do for my patients.
Well, and what we've got going on right now with I just feel like I'm seeing post after post after post about um different creative ways to solve the hygiene shortage, right? As far as letting foreign trained dentists maybe do it, or assistants or whatever. And it's like, this is a complex issue. And I'm not saying that there is an easy solution, because there isn't. But perhaps we should look at allowing dental hygienists to really practice at the top of their license and let them do what they're capable of doing. And you are a prime example of someone doing just that. We're in Colorado. You can own your own practice here. So you've taken advantage of that. And I have seen your van and all of the different things that you offer that people probably won't get exposed to at a traditional office. And you are like maximizing every little inch in your license. So, what kind of things do you offer in your van that maybe patients wouldn't be exposed to at a regular private practice?
So, one of the main things that I feel is a really great tool is salivary diagnostics, where we are actually looking for pathogens that are scientifically proven to be linked to these systemic diseases. We know that there are certain microbes, and there's 5 of them that are really at high risk for contributing to and driving inflammatory diseases like heart disease, Alzheimer's, cancer, linked to diabetes, a lot of different things. And I think that is one of the places that, I love this phrase that I did not coin, but they say if you're not testing, you're guessing. And so patients, the way they present clinically and using a periodontal probe to measure existing damage and destruction is not really the way to diagnose a patient. You need evidence, like you don't walk into a doctor's office and they look at you and say, "Oh, yeah, I think you have high cholesterol, or I think you have, you know, diabetes." Well, they have to do testing. They have to test your blood to find out. And at some point, I think there's going to be, which I think it's happening already, that, saliva is the next blood test. There's tests that can be done, and which is less invasive, and patients are more amenable to it. But anyway, so that's where that testing pH,
Mhm.
testing nitrate levels in patient saliva, which nitrate is the foundation substrate precursor, if you will, to nitric oxide. And nitric oxide is a huge molecule, signaling molecule that the body needs for vasodilation, for pretty much it's linked to everything in our system. And so when people, that's a way to get into the whole nutrition aspect of people is when you're checking their nitrate levels and they're low, then you talk to them about, are you getting enough leafy greens and what's your diet like? And, we learn, I don't think that as hygienists, and I know I didn't do it very much when, other than telling people to stay away from sugar, when, we took nutrition in school, and that is part of the way we can support our patients. But, first of all, we don't have time. And second of all, a lot of people, aren't delving into that in the appointment, but we can do so much more to help patients. And so salivary testing pH every time, doing, checking nitrate levels, and then doing a thorough cotton method oral cancer screening with, the telescope, which is a tongue depressor that's lit up that you can see things better. You can take pictures with your iPhone from it, and it's a whole platform that is very cool. And then Velscope, which looks under the tissue. And so these are things that I do at every appointment, and
Wow.
it's just standard. And so, and we're following it, we're doing things like if a person's, I educate them about their pH. I educate them about, what they're drinking, what they're eating, and how to monitor it and test it at home, and different products that, have low pH and all that kind of thing. And just giving them more substance to why we're telling them to do things. Because basically they've heard the floss more
Yeah.
pitch for years. And,
Yeah.
And then also with nitric oxide, there are commensal bacteria, good bacteria on your tongue that actually help take the nitrate from the vegetables and fruits and convert it to nitric oxide, or to nitrate to nitric oxide. And so without those commensal bacteria, if we're using, heavy duty antimicrobials, we're killing that off. And so explaining to that, and also that, tongue brushing is really important to keep those nitrate reducing bacteria in good numbers. And, talking to them about prebiotics to feed the good bugs, and oral probiotics, and all those kinds of conversations and education takes time. And so with my practice and being able to have as much time as I want with my patients, I'm able to do that. I'm able to monitor. I'm able to follow up and say, okay, well, what are you doing that we, because sometimes patients and we as people can't put everything in place. It's like baby steps. And sometimes,
Yeah.
okay, we're going to work on this. And then they come back and I say, well, what if that we talked about, were you able to do? Tell me about what you're doing right now. And, what is working, maybe what weren't you able to implement, and then we work with that, and then we try to figure out other things. And so it's very personalized and targeted to that person. And, we collect saliva and we find out what pathogens they have. And there are different pathogens that respond better to certain modalities, whether it be laser or ultrasonics or scaling or certain probiotics or whatever. So everything is very much specific and targeted for that patient. And then things have to be tweaked over time because everyone is different. Biologically, we're the host response. Remember in school, everything was about the host response. Well, we're the host, and all of us have different genetics, different diets, different habits, different um, the environment is different. And so you have to just constantly be asking questions, and you get the patient to critically think for themselves too. Because once they start learning about this stuff, and I give them lots of ideas of books to read and things to, websites to go to, and, also screening for airway things and talking to them about sleep apnea and things that I'm finding in their mouth that put them at risk in the future for things, tethered oral tissues, like all these things are discussed, and I have resources for them about that, which brings me to why I am writing a book, and hopefully
Mhm.
it's going to be launched at the end of this year. And the book is called Hope for Health, Illuminating the Foundations of Health and Wellness. And basically, I've had this dream of writing kind of a resource for my patients, because I'm not able to tell them everything and at every visit, and some things that, we miss or whatever. But if they want to learn some more things, it's basically talking about the body, the mind, and the spirit, and all the things that are free, and other things too, but basically things like, grounding and posture and breathing correctly and sleep hygiene, and all the things and resources to go to, because I'm not an expert in all the areas, but if something, I see a problem or an area that might be a patient has an interest there or has an issue with, I want to direct them to the experts in that area. And so that's what my book
Mhm.
is about. It's just like kind of saying that, it doesn't have to cost a lot to be healthy, and to also, there is hope that you can improve your health. And I mean, I'm not the healthiest person on the planet either, and I've had my own health journey, but I wish that I would have had some of these resources, back then. That's what I just love about the internet now, is because, and about, podcasts and our social media and everything, because we can learn so much, and there's just so much to learn and so much
Well,
that
and
we can share.
there's a lot too because I know me, if I'm going into the doctor or whatever, and they tell me like 10 things and I leave and I'm like, what just happened? Like, what did they just say? Maybe I remember one or two things. So it's
Yeah.
nice to have a reference for them to kind of go back to. I'm sure that you're going to write it in a way, that patients can understand. Because even we get a little scientific sometimes, and I feel like not everyone's really going to get it. But I think that's great. So that's gonna be out when? Next year?
Yeah, I'm hoping by the first of the year. And so
Okay.
I think I'm going to officially be launching it at the end of February at the National Mobile Teledentistry Conference. I'll be on a expert panel there, talking about medical dental integration, because that's
Oh,
my
awesome.
other thing that I really am passionate about, because I think I alluded to that a little bit earlier, but getting hygienists should be part of the healthcare team within medical offices, OBGYNs, pediatric offices, chiropractors, functional medical offices. Like, a hygienist should be part of like your annual physical kind of thing, because all the things that we do, you know, screening for airway and sleep apnea, like, there's so many people that are undiagnosed with sleep apnea out in the world, because basically, until they're so far gone, does their physician tell them to get a sleep test.
Yeah.
And if we're there screening, we can say there's this and this and this, that this person is at risk for sleep apnea or some type of sleep disordered breathing. And, checking for tethered oral tissues in children, and, you know, things for growth, and just doing saliva testing, because there's people that are on these medications and they have these chronic conditions that, if we got their mouth healthy, it would help improve and support their immune system to fight all these other things that they have going on. And so I belong to the National Network of Healthcare Hygienists, and that is an organization that their goal and mission is to get dental hygienists on every medical team
I
in
was
the
going to ask you
country and in the world.
how can we make this happen? Because it's like 2024. How long have we known about oral systemic health? How long have we known all this? And we're
Yeah, it's
still,
been 25
it's like
years
the dark
and
ages
we're
sometimes, you
still,
know?
yeah, it's a slow movement. However, recently the new American Dental Association is starting to get on board more than uh just talk, but they're
Yeah.
starting to get more on board with oral systemic. And now the ADHA too, with the leadership that we have, they're also pushing the agenda of hygienists as a first line, elite health provider. And so we know a lot of things, and we can really, like, there shouldn't be any kind of thing called burnout anymore. And that's what I'm really passionate about too, is really reigniting the passion and purpose of hygienists to see that they're more than just, you know, what
Two
they're doing
scrapers.
at tooth scraper in an
Yeah.
office where it's just like, you're going through the motions, you're just tired of the schedule and all those kinds of things. If we could get dentists to realize the role that we have and what we really can contribute and impact as prevention specialists in helping patients prevent disease systemically, that they will start realizing that it's more than just the production that a hygienist does. Although we can produce like crazy, especially if we're diagnosing periodontal disease as much
Yeah.
as prevalent as it is.
So you have talked about like everything that you do with your patients as far as all of the assessments that you're doing and nutritional counseling and saliva testing. Like I am 100% on board with all of that. However, working at a traditional practice, there is no time. I mean,
Right.
there is no time, especially when the appointment is even being shortened to like 40 minutes or God forbid 30 minutes. Anyway, I want to hear, and I know that that's part of the reason that you created your mobile business. So I want to hear what what does a regular appointment look like for someone seeing you? And are you actually like traveling to their home or are you traveling to facilities to see your patients? Are they coming to you? Like, how does that work?
Okay, so like I said before, that I originally was planning to just go to a home and see the whole family, and that would be my day, 5, 6 hours, depending on how many people. And I do have some families like that, but about 1 or 2 years into my practice, a biological dentist that I had worked for before um, couldn't find someone that was doing what I was doing, and I had already had my practice, and she knew about it, and I was trying to help her implement that and find a hygienist that could do what I do in her practice. And I mean, she had a schedule where there's 90 minutes per patient, which is really good.
Mhm.
And they do ozone and a lot of different things, which I haven't been able to implement in my van yet, but that's one of the missing pieces that I would like to do. But so she decided to close her dental hygiene department and asked me if I would service all her patients. And so they would go in as a new patient to her and get all their x-rays and their assessments. And most of her patients are like people that are needing full mouth cases and bite reconstruction, that kind of thing. So they would go see her, and then she would send all their x-rays and perio charting and everything to me and say, okay, I need you to get them healthy enough for me to treat them, and then also do their maintenance and everything. So then I started getting patients that were coming one at a time. So oddly enough, that I see those type of patients, I'm not driving all the way to Arvada or from Castle Rock or something to see one patient and then, having to go
Yeah.
to another part of town for one patient. So they do come to see me. And so individuals come to see me at my house, and I usually see only 2 patients a day because it's like a half a day because each patient is at least 2 hours, and I always leave a buffer in there. Um,
Is the 2 hours for an initial visit or for every appointment?
every appointment.
Wow, okay,
So it's
that's
the initial
awesome.
visit, and sometimes the initial visit will go longer than the 2
Mhm.
hours, but I always have extra time in case, just in case. And then every visit is scheduled for 2 hours, and sometimes it'll be over in an hour and a half or an hour and 45, because we're just really doing a deep dive with everything. And my patient base are patients that are very, they're not insurance driven. They're health optimizers. They're, biohacking people who are doing
Mhm.
everything proactively to take care of their health. And I think that because they're educated and they're looking into their health, I think if we educate our patients, we can get them to do all these kinds of things that insurance don't pay for, because my patients are paying for them. So, for
Yeah.
example, my new patient appointment is $590 for 2 hours.
Mhm.
And that includes, and my fees are really lower than usual and customary that are out there, like for laser and everything else. I'm not charging what is the regular fees. So like in a dental office, because I don't have as much overhead, but in a dental office, there is money to be made. There is production there with doing all these things, with doing irrigation on every patient, with doing laser on every patient. And these patients know up front what I'm going to be doing. They know what the initial visit is, and they know what the future visits are going to be. And so like for a recare appointment, they might not be getting, like they get an FMX on their first visit. They might not be getting the saliva test. So their recare appointment could be anywhere from 265 to 300 or so, depending on if they're perio maintenance or a regular prophy.
So for an initial visit, like if I'm coming to see you, what would that appointment look like for me as a new patient? Like, are you doing FMX and probing and charting
Yes,
everything and then
yes,
maybe testing? Okay.
yes. So we start out with obviously doing a really deep dive into medical history, and
Mhm.
also talking about patients' concerns and their dental history. And they tell me their whole life story about
I
everything,
bet.
everything that's happened in their dental life, the other offices they've gone to, their concerns, their fears, their medical history. I do that with them, and I ask them, have you had this? And then they tell me, and then I write it down, and then we discuss it. And so that part is quite a bit. Then we do all the salivary testing that I explained, pH, nitric oxide, da da da. Do the oral cancer and screening with the Velscope and everything. Then I would take x-rays that would
Mhm.
be appropriate. And then I would lay them back and do an LBR. So everyone gets LBR before I probe or before I pick up an instrument.
And what is
So
LBR, just in case
so
people don't know?
LBR, in case people don't know, it's laser bacterial reduction. So I have a diode laser. And so I'm trying to reduce the bacteria as much as possible. I also do a pre-treatment rinse with doTERRA. It's called On Guard, and it has a lot of antimicrobial essential oils. So that's
Mhm.
the first line of defense. And then I do the LBR because I don't think that people realize, or do they know that when we get in there and we're doing a cleaning or we're doing probing, we're increasing the amount of bacteria that's going into the bloodstream. If there's any inflammation at all, if there's any bleeding, those bacteria are just flooding. And so some people will feel sick after an appointment because they're getting this bombardment of bacteria. So I'm trying to reduce that load by doing the laser bacterial reduction. Then I do a perio charting, full perio charting recession. I take intraoral photos, and I record everything from wear to abfractions to erosion, their restorations, everything. I also measure their transverse measurement, which is for screening for, I look at their Mallampati score, I look at their tonsil score. So I'm looking at everything. Their transverse measurement is a measurement from first molar to first molar, which should be like 40 millimeters. And I mean, some adults that I have, they're 27 or 30 millimeters. So they're like
Jeez.
10 millimeters smaller. And so it's not that their tongue is too big for their mouth, it's that their mouth is too small for their tongue. And I mean,
And
that's
would
a
you say
whole,
like 10 out of 10 they have breathing issues if they're
yes,
that narrow? Okay, yeah.
absolutely, absolutely. And so this is very eye-opening, and we discuss all these things, and I explain to them all the data that I'm collecting. I explain why I'm collecting it and what it means and making appropriate referrals, which I do go over a lot of things. And so then when the appointment is over, after I do my notes and everything, I will send them a recap email of all the subjects that we talked about in their specific visit, and then links to things or books or products or whatever. So I spend a lot of time on my notes and on my communication with my patients afterwards, because it's a lot of things to go over and they aren't going to remember it. Plus I give pamphlets out and that samples of
And you'll
things.
be
And
able to reference your book here pretty soon, which is pretty sweet, and be like, "Oh,
yeah,
hey, just here's my book."
yes, that will
So
be more helpful. So then
yeah.
I do perio charting, tooth,
Mhm.
restoration charting, um, all those things, and then I will perform either a you know gross debridement or a prophy or you know a scaling with inflammation without calling out codes and stuff. But yeah, so and so I perform that, and I'll know that they're probably going to have, and I educate them if they're going to need, if they've got perio issues. I don't know what their pathogen load is yet, because I've got to wait for their test results to come back. So, but I give them a heads up. I'm like, here's your bone level, here's all this. So I do everything pretty supra that first appointment.
Mhm.
And then if they need, if I'm pretty sure they're going to need scaling and root planing, which is, treating some doing some non-surgical periodontal therapy, then I educate them about that. But I say, we're not going to make any decisions about everything until until I see your test. And then we make a plan, and I discuss that with them over the phone. But also after I finish scaling, I always do an irrigation with molecular iodine around all the teeth. And I make my own prophy paste out of coconut oil, baking soda, and I do this chairside essential oils and xylitol. So that is basically the appointment, and all of that. It takes about a couple of hours, sometimes a little bit longer, like for initial appointment. And then I spend probably an hour on the phone with the patient when we review their saliva test results at a different
Okay.
time. Like once they come in, I upload them into their chart. I send them a copy via email, and I do a little synopsis explanation of what the plan is and their treatment plan. And then we make a phone call appointment, and then I go over everything with them, and we talk about the next steps and
That's
go
a
from
lot of
there.
value, Janet. That's a lot of value. You
Mhm.
had said that you are working with like a biological dentist right now and getting some referrals from them. But let's say I came to you, just like I found you online and I came to you and I needed dental work. How does that work? Do you have dentists that you refer out to?
Yes, depending on
Okay.
what they need. I do, because so I have temped for probably 10 to 12 years, and I've met a lot of dentists, and I have a relationship with a lot of different dentists. And so depending on what they need, say, they're not in the market for getting full mouth reconstruction, or they're not really ready for the whole biological, remove all your mercury fillings and things. And
Yeah.
say they just have one little cavity and they do have dental insurance and they want to utilize it, I'll refer them to a certain person. So it depends on their, what they want. Like, do they want to go to a biological office? So I have a lot of resources that I could send them to, if I see that they have a tooth that has some type of periapical radiolucency, some type of,
Hmm.
I will send them to actually one of the best endodontists is here in Castle Rock, Dr. Susie. So I will send them to him, and I've been referring patients to him for years. And so, depending on what they need and what they're looking for, yes, if I see problems, and we know how to see a problem on an X-ray and in the
Yeah.
mouth, and I, forward their X-rays and their intraoral photos, and I make the appropriate referral if they need work,
How
and
has your
then
experience
come back to
been
me.
as a independent hygienist? Have you experienced any friction from other, maybe dentists that don't necessarily agree with it, or has it been pretty supportive overall?
So far, very supportive. So I
Good.
still temp sometimes
Hmm.
when my schedule isn't very busy, or I have different people that will reach out to me and say, "Hey, Janet, so and so's going on maternity leave. Do you have any time that you can give us a few days here or there or whatever?" And so all the dentists, and I'm very privileged that all the dentists really support my business in what, I don't feel that they feel that I'm competition with them. And they think it's really cool. And sometimes, when I temp at an office, I don't tell patients that I have my own practice because I don't want
Yeah.
a conflict
Yeah.
of interest. But sometimes the dentist will come in and say, "Oh, yeah, Janet, she's taking really good care of you. She has her own mobile practice," kind of, and they'll mention it. And I'm like, "Oh, that's really
Well, if they
nice
do it, that's
of
okay.
you."
Yeah.
Yeah, if they do it. But, so far, they're very supportive. And the reason I still tempt too is because I'm trying to spread my impact and message of, you guys need to be doing this. Hey, are you doing this? Are you doing that? And back to what you said about not having enough time, dentists need to start giving hygienists more time to do what I'm doing, because
Yeah.
there is going to be financial. They just have to stop, just thinking within the box that they're in. This, you have to see one patient per hour or less, and insurance driven and all this kind of stuff. Because I really believe that with proper education and an amount of time that the patients can spend with a hygienist that is passionate, that really wants to help them. And I think we all got into this profession because that's who we are for the
Yeah.
most part, I think. And so, if they're allowed to do that, the patients will want to do the salivary testing. They'll want to do the laser with every appointment. They will spend the money out of pocket, because my patients, I don't work with insurance anymore. I did for the first 2 years, but it was too much for one person to handle. As an owner operator of a business, it's a lot of work, as you know.
Yeah.
And that's what is one of the things that is the hard part, is the business side of the business. If we could just do what we do, and not have to worry about that, that would be great. But I really look forward to the day, and that's why I just keep wanting to spread the message. I look forward to the day where dentists are going to start hygienists aren't going to be wanting to leave a dental practice that is supporting them in operating at the top of their scope, and also being able to offer all these things that just help you serve your patient better for their
Well, yeah.
overall
And I
health.
mean, dentists cannot tell me that having a pro female or making sure that your hygienist is seeing enough patients so that they produce $1,500 a day. You cannot tell me more that that's worth more than actually spending time and educating your patients and building these relationships. And then that patient, maybe a couple of years later, decides to do that full mouth reconstruction at $60,000, or decides to do ortho or get those veneers. Like, you can't tell me that this daily production goal BS is worth more than that, financially. Plus,
It's
they're going to
not.
refer people to you. Like, I just wish that they would just, like what you said, think outside of their little box where they're requiring like these production numbers, and just think of the big picture,
Yeah.
and it's not going to burn out your hygienist.
Yeah. And they're going to feel like you're going to have a practice that is growing organically with patients that
Hmm.
really value what you do versus, oh, I'm just going in here and I'm just going to get my whatever the insurance pays for today. And patients that are insurance driven, it's our bad because we haven't
Yeah.
educated them properly.
Yeah. But we
It's
need the
just,
time and we need the
yes,
support to do that.
we need the time
Yeah.
and we need the support and we need dentists that have a bigger vision and
Yeah.
mission than just
Yeah.
getting that production in for the day because the production will come with better care.
And it does come. I've seen it. So before we wrap up, I love what you've created. I've seen Janet's van, by the way. It is souped up. It's so cute. It's comfortable. She's got like everything you could need. But if somebody wanted to start thinking about starting their own mobile business, what advice would you have for someone like that?
Well, I would say that if you have a passion for it, then go for it and don't be afraid because if you build it, they will come. And and you will have, peace and you will have, it isn't easy because there was a lot of blood, sweat, and tears in the beginning
I
because
bet.
I was trying to deal with insurance. That was my biggest headache. Um, and, marketing, I'm a boomer, I'm a baby boomer. And so I don't know technology very well. So I'm not really marketing myself but I'm also trying to impact in a different way. So I'm not trying to get, 5 days a week, 8 patients a day or anything like that.
Hmm.
Um, but someone who's younger than me and someone who, I mean, the investment is a lot, but you don't have to start out with a van. You can start out small. You can start out with just your mobile equipment and you can, go into people's homes or you can, go to nursing homes. There's like a lot of different ways. And then if you want to go really big, a brick and mortar would be awesome, and which a lot of hygienists in Colorado do. And I would just say follow your heart and follow your passion and have that freedom to really do what you think is best for the patient and not have your hands tied. I think that
Yeah.
if I had done this at a lot younger age, that, I would probably be able to grow more as my individual practice. But just at this phase in my life, I'm exactly where I want to be positioned. I see as much patients as I want to. But I mean, the sky's the limit, really, of what you can do. And there's no such thing as saturating the market. Only
Yeah.
40% of population even go to the dentist. So
That's
there's
so
so
crazy.
much, and it's so much more of a message. Like we need to put the message out there that you need to take care of your mouth because it's so linked to your health. And so
Yeah.
that's, I would just say to any hygienist, don't hesitate. I wish I wouldn't have hesitated, but there's a lot of resources, a lot of people that can help. Anybody
That's what I
can
was going
reach
to
out
ask.
to me.
Like, yeah, are there resources that people can maybe, I don't know, find a mentor, or is there like a website that will help with like steps on what they need to do?
So the National Mobile Teledentistry Conference is once a year, and there's a lot of people there in the public health space. And also, reach out to first of all, you need to be a member of ADHA. You need to be a member of your local component, which I didn't do early on because I was a single mom, 4 kids, working, crazy hours. But it's really important because they support our profession, but also they will create, there's possibilities of creating uh, support and resources for whatever we're needing. Like our component, if there's more people in mobile, they're going to, we want to see more of this content. We want more of that help. And there's the American Mobile Teledentistry Alliance. And then there's just people like me who you can call.
Yeah.
And, I have other friends that, I mean, I'm pretty sure like there's not very many people that because they have a passion for what they're doing, they're not going to help you. And I mean, when Brush with Brit interviewed me at RDH Under One Roof, I had people contacting me from all over the country that
that.
wanted to know how I did it. And, I was getting phone calls, I was getting people reaching out to me. But I don't know all the rules in all the states. So
Yeah.
that's
And they need
that's
they
the
need to figure that out for
yeah,
their own
that's
state.
what they
Yeah.
need to figure out, because there are dentists like Dr. Mark Burhany, who is Ask the Dentist, who was at RDH Under One Roof, that he came out and saw my van and he's like, how can I help? Because we need to get more people being able in every state, every hygienist in every state, in every part of the world need to be able to do what you're doing. And so
Mhm.
he, asked how he could help. And a lot of dentists are pro hygienists, like Mike Zubiak, who wrote a book called Hygiene Superstar. If you haven't got the book, you have to read it. And it will make you really take pride in what you can do. And there are some dentists that really value hygienists. And
Yeah,
if we can
definitely.
get that message out, and if we, even if you're in a practice that is maybe not up to that, if you continually plant seeds and everything, I think things will change. There just has to be more communication between the dentist and the hygienists, and just more goodwill towards each other and towards mankind. Because really, we have a big part to play in this global health crisis. And
Yeah. Well,
we
we need
just
to
need to run with it.
people need to open their minds and, look at what can be done, not what like has maybe worked, quote unquote, worked for the last 50 years. Like we need to evolve. So I just wanted to thank you so much for your time today. And I just love what you're doing. And I think you're setting a really good example for, inspiring other hygienists of what can actually be done. And yes, it is, I'm sure, a ton of work, but look at what you've created. You're helping people, you have autonomy, you can set your own schedule, which is a dream. I'm going to make sure to put all of your contact information down at the bottom in case people want to reach you. But what is the best place for people to reach you?
So, my phone number is, you can post my phone number,
Okay.
and they can text me, and then we can set up a call because I'm not always available to answer. They can email me, which Janet at hopeforhealthco.com, which you can put up there. And, I have a website. It's very simple, but it
Mhm.
explains what I do and everything. And so if they want to hear, but yes, I always have time to talk to other hygienists and, you know, just either inspire them or give them hints or whatever. Like, I don't know all the rules in the other states or anything like that, but I can help any way that I can. And I really want for the impact of their hygienists in a way that empowers them and says, hey, you are so important and your job is so critical that,
Yeah.
you know, don't be stuck in a place where you're not happy, where you don't feel like you're able to fulfill your mission of helping your patients. And, think outside the box and challenge your employers and say, hey, open their eyes to things. And again, and join your professional organizations and other organizations. If you're into oral systemic, if are into biological or whatever, there's so many organizations out there that you could learn and network with people and go to their events and things. You won't regret it.
Yeah, networking is huge, and that's something you're really good at. I've noticed. Well, thank you, Janet, for your
Thank you,
time. I'll put all of
Stephanie.
your contact information at the in the show notes for people. And good luck with your speaking gig that you've got next year and your book. I mean, that's going to be a big year for you. And thank you for coming, and thank you everyone for listening.
Thank you. Bye.
All right, guys, we'll see you next time.